Hi, welcome everybody. It's now 12:30. Thank you for spending your lunch hour with us. These are our first combined Regional Geriatric Program Central and Geras Centre for Aging Research and McMaster rounds. The topic today is enhancing brain health and aging through exercise and exogenous ketone supplements. And we'll be recording the presentation, and it'll be available on our YouTube channel. We are privileged to provide care on the land that Indigenous people have called home for thousands of years. Really delighted to have our speakers, Dr. Jeremy Walsh, join us today. Jeremy is an assistant professor and the director of the Brain Exercise Enhancement Lab. Enhancement, I'm wondering how we're enhancing the brain, so we'll learn more today in the Department of Kinesiology at MAC. And Geoff Coombs is the postdoc fellow with the department. So I'm going to turn it over. Really delighted you were able to join us today. The information about any of the research will be both available on the MIRA website and through Voice, where all clinical trials occurring can be found, and also the Geras website.
Great. Well, thank you for the introduction. And we're delighted to be here today and for everyone to be spending their lunch hour with us. I'm Dr. Jeremy Walsh, and I'm here with Dr. Geoff Coombs. And yeah, we're hopefully going to chat about how both exercise and ketone supplementation can protect brain health, but also likely enhance it and protect against neurodegeneration and aging. So a brief intro to us, given this is our first interaction with the group. We're both in the Department of Kinesiology at MAC, and the research that we focus on is understanding the physiological mechanisms by which exercise and other behaviors enhance cognitive function and brain health, with the intention of using this understanding to build interventions, typically multimodal, for preventing neurodegeneration or protecting against it in aging. Very briefly, we focus on vascular health of the brain, including brain blood flow, cognition, and some neurotropic growth factors that enhance brain plasticity. So the overview for today, in terms of the learning objectives, we're first going to talk about how reductions in brain blood flow increase the risk of dementia, but then look at how exercise can preserve brain blood flow specifically. We'll focus on some of the neuroplasticity and growth effects of exercise for the brain. And then we're going to introduce a novel exogenous ketone supplement that we're currently working with and pitch a few projects that are happening in the lab, identifying this as a potential complementary therapy for protecting brain health and aging. So I'll pass it over to Geoff for now, and then I'll chat with you soon.
All right, thanks, Jeremy. Okay, I don't want to spend too much time on the background here, but just to note that although Alzheimer's disease is the leading form of dementia, I'm going to be focusing more specifically on vascular dementia. And this can be difficult to quantify, but estimates put this at about up to 20% of total dementia cases. So that makes it the second most common form of dementia. And I think something that's important to note with this as well is that estimates also place about 30 to 60% of cases of Alzheimer's with some kind of vascular pathology. So in reality, a lot of cases of dementia are probably mixed between vascular and Alzheimer's mechanisms. And so on that note, this is from the Heart and Stroke Foundation of Canada. 90% of people in Canada have at least one risk factor for cardiovascular disease and also vascular cognitive impairment. So when I talk about vascular dementia, what I mean is that it's relating to blood flow going to the brain. All right, and so why is it so important that we think about blood flow going to the brain? Well, first of all, the brain only makes up about 2% of our total body mass. but it actually requires about 15% of total cardiac output or total blood flow throughout the body. And it uses 20% of total oxygen and glucose consumption throughout the day. So the brain is a highly metabolic organ. It's constantly active. And one really important note here too is that it has a very limited capacity for energy storage, okay? So it can't really store energy in the brain. That's why we need that constant supply of blood flow, delivering oxygen and carbohydrates to create energy in the brain. And because of this, interrupting that supply of blood flow can lead to unconsciousness in very brief moments. So only 5 to 10 seconds of ischemia or lack of blood flow will lead to unconsciousness very quickly. Okay, so what happens to blood flow going to the brain as we get older? All right, so in this graph here, we have the percentage of blood flow of the entire body going towards the brain. So in our younger years, close to 20, this is around 15 to 20%, like I mentioned. And as we get older, we can see that linear decrease in blood flow going to the brain with age. And I think it's important to note here as well that there are some sex differences in this relationship. We don't fully understand the mechanisms of these differences yet, but it's important to point out that at the younger ages, middle-aged, and older age group, the percentage of blood flow going towards the brain seems to be higher in women compared to men throughout the age span. All right, so what can we do about this decline in blood flow going to the brain as we get older? Well, let's think a little bit about exercise and what happens during an acute session or a single session of exercise. If we focus on this top left figure here, this is blood flow going to the brain from rest, and then as we increase exercise intensity. So as we go from rest to mild and moderate exercise intensity, we actually get pretty linear increases in blood flow. And that comes down a little bit at high exercise intensities, although note that this is still above the resting values. And the reason for this increase in blood flow during exercise is multifactorial. Like I mentioned, the high metabolic demands of the brain require very tight regulation of blood flow through different physiological mechanisms. And those mechanisms can also be stimulated through exercise. So if we just look at a few different ones, with the cardiovascular system, for example, as soon as we begin exercising, we increase our cardiac output. So blood flow throughout the entire body is increasing. We also increase our metabolism. So we're producing carbon dioxide in our muscles. We're inhaling more oxygen. So we're sending more carbon dioxide and oxygen to the brain, both of which can increase blood flow. And of course, we are using our cognitive capacities in the brain. So we're increasing neural activation within the brain in order to tell our muscles how to move. And that neural activation will also increase demand for blood flow in specific regions of the brain. So together, the stimulation of all these physiological systems during an acute session of exercise will result in kind of this increase in blood flow that we're seeing acutely. Now, how can that kind of help us as we get older? Well, if we take a look at this graph here, again, this is brain blood flow on the y-axis across the age span. And what we can see here is two different groups. So it's going to be a sedentary group, which is this blue line, and a trained or an exercise trained group of individuals in this red line. And essentially what you can see is that throughout the lifespan, the blood flow going to the brain is a little bit higher in the trained group. And they decline with age as well, but the absolute amount of blood flow going to the brain is maintained at a higher value throughout the lifespan in this exercise trained group. And it may not be a perfect calculation, but the author of the study estimated that the age of the brain was about 10 years younger in the exercise trained group compared to the sedentary group. And that's just based on pure blood flow values, kind of no other considerations going into that. So take that with a grain of salt. But it seems that staying active throughout the lifespan can maintain higher levels of blood flow going to the brain. And there's potentially a few mechanisms through which this can occur. One of them might be greater brain vascularization. So we can take a look at a quick study here that used magnetic resonance angiography to quantify the number and size of blood vessels in the brain. So you can see an example on the left here. And what they found comparing inactive versus active older adults is pretty interesting. So we'll focus on this figure at the top here, which relates to the brain as a whole. The same story is consistent in different regions throughout the brain. But basically what we can see here is that the number of blood vessels in the brain is greater in individuals who are more active compared to those who are less active. And this is occurring in blood vessels in a smaller range. So you can see this is the vessel radius starting at 2, getting to a smaller size here. And it's particularly small blood vessels that are greater in number, which makes sense when we think about angiogenesis and the ability of capillaries to be greater in number throughout the brain. So there's one other study that can provide a bit of evidence here. This study compared masters athletes to healthy age-matched controls. So I find this study really interesting because it didn't take sedentary and normally active adults, but now we're comparing middle-aged and older masters athletes. So these are people that have been training and racing at the professional level for greater than 30 years, really high training volume, more than 15 hours per week. And we're comparing them to actually healthy active control subjects. So these are age-matched individuals who actually meet the recommendations for exercise, which equates to about 150 minutes of moderate intensity exercise per week, kind of spread throughout the week. And they measured cortical thickness of the gray matter using T1 MRI. So you kind of see an example on the top right here of regions that were different between these two groups. And essentially here are the main findings. So they found the same thing between the left and right hemispheres, and also in a few different regions throughout the brain. But essentially what we can see is that compared to the control group in the gray bars, in all kind of regions and hemispheres, the black bars showed higher cortical thickness, meaning that the masters athletes kind of had, in these specific regions throughout the brain, kind of potentially had greater structural changes compared to their less active individuals. So kind of my take home at this point would be that exercise seems like it can increase blood flow acutely, and it can also maintain blood flow or mitigate the decline in blood flow as we get older. And this kind of masters athlete study here suggests that this might occur in a dose-dependent manner. So I'm going to take a second here to switch over to Jeremy, and I think he's going to expand a little bit on some more mechanisms of how these things might occur, and also specific exercise recommendations.
All right, great. Thank you, Geoff. I assume we can see my screen and we're good to go. So we talked about enhancement. Geoff showed some really interesting data about protection of exercise across the lifespan. And so what about this notion of enhancement? Well, in a really seminal and interesting paper, a group of older adults were asked to walk for 1 year, 3 times per week, and they're previously sedentary adults, so starting an exercise program, and they're compared to a group of adults who just stretch 3 times per week. And the primary outcome of this study was looking to see how exercise impacted the volume of the hippocampus. And you might be familiar with this structure because it is integral to learning and memory, and it's one of the first structures to be impacted by dementia and Alzheimer's disease. And atrophy of this area is associated with a lot of neuropathology. So what the authors found was that after 1 year of walking, so not a crazy exercise intervention, both the left and the right hippocampi grew in size in the exercise group. What's more striking about this trial was that over the course of 1 year in the control group, there's about a 1 to a 1.5% decline or atrophy just due to aging. So the takeaway here is that exercise not only protects against age-related declines in brain volume, but also it causes the growth of new brain tissue, kind of like a muscle. The more you use it, the more it's going to grow. And you might be asking yourself, well, does the size of the hippocampus matter for function? And what the authors found was it absolutely does. So if you look at this graph, it's the correlation between the changes in someone's hippocampal volume with training compared to their memory performance over that 1 year period. And you can see that those who had an increase in hippocampal volume tended to do better on memory performance. So size does matter for our memory performance. And this is also relevant to people who have subjective cognitive decline or the early stages of maybe mild cognitive impairment. So in a brief 4-month training study, folks with subjective cognitive decline had their hippocampal blood flow measured by arterial spin labeling, or MRI, as well as looking at the connection between the hippocampus and other regions relevant for cognition in the brain. And in both cases, after a brief intervention, the authors found that hippocampal blood flow bilaterally increased in these folks, and also there was an increase in brain function. So we have greater communication between the hippocampus and an area called the anterior cingulate cortex, which is critical for attention and inhibition. So collectively, we're doing more than just preventing that decline in age, but we're actually seeing this enhancement with pretty low doses of exercise. So for folks in the audience who are practitioners or want to know what should I tell my patients or tell people that I work with, a really interesting paper came out recently trying to take what we know so far about the effects of exercise on cognition and give a minimum amount and an optimal amount that we should do per week. So as it relates to doing aerobic plus resistance training, it looks like doing 35 to 70 minutes of moderate to vigorous physical activity per week is the minimum for an improvement in cognition. And we see optimal changes around 75 to 140 minutes. In terms of walking, more is better, but again, we're still sticking within that range of about 2 to 3 hours per week. For resistance training, again, within that same range. And then mixed aerobic could be a whole mix of different types of aerobic activities, from aquafit to walking, and they all fall within this range. And the reason I think that this evidence is critical is that if we look at the Canadian Physical Activity Guidelines for older adults, the recommendation is that older adults should get at least 150 minutes of moderate to vigorous physical activity per week, as well as including at least 2 days of strengthening exercise. Although this data is still early, I would say, we still need more. The findings from that previous slide are perfectly aligned with these guidelines. And I think older adults should be encouraged to get that exercise that causes huffing and puffing and heart rate elevated a bit, but doing an activity that they enjoy and that they will continue to do on a daily basis for promoting brain health. So this is a brief seminar today, and I'm going to make a hard transition from exercise towards these novel ketone supplements that we're also going to discuss today. So one of the changes that happens with aging, like reductions in brain blood flow, is a change in our ability of our brain to use glucose for fuel. And some people have suggested that dementia or Alzheimer's are considered type 3 diabetes because our brain reduces its capacity to use glucose for fuel. So in this graph, using PET imaging, we can see that compared to a healthy control group where more yellow, more red color indicates more glucose metabolism, folks with mild cognitive impairment or Alzheimer's disease have a reduced capacity to use glucose for fuel. This is a major problem because the brain primarily relies on glucose for fuel. But one thing that is preserved as we get older, even in these advanced pathologies of dementia, is that the brain can still use ketone bodies for fuel. And what this graph is showing here is that if you infuse more ketone bodies into the blood, the brain will directly take it up and use it as fuel. So what we're suggesting here is that if we can find ways to increase ketone bodies in our blood, we might be able to rescue this energy deficit in folks who have increased risk of dementia. And there's some really interesting early preliminary findings showing that infusing ketones has a rapid impact on our brain function. So this is in older adults who have normal cognition. And after infusing ketones for a couple of hours, we see a reduction in brain glucose metabolism, which is being offset by ketones being used for energy in the brain. Another critical thing is that we're actually seeing brain blood flow is going up during the same period. So Geoff showed us that importance of maintaining brain blood flow and also supporting our metabolism. It appears like these ketones might have a positive impact. However, until recently, the only way to increase ketones appreciably in the blood was to either starve yourself or partake in a ketogenic diet, which is very low carbohydrate. These diets are very tough to adhere to and they're restrictive. But recently there are these ketone supplements, which is essentially a drink, that have been developed that can rapidly induce nutritional ketosis. So this graph is showing over an hour and 20 minutes, or a 2-hour period, that ingesting a single drink of ketone monoester can increase the levels of beta hydroxybutyrate, the ketone body, in our blood to what looks like 4 days of fasting. So this has a massive, rapid increase in ketones in the blood. And what's more important, and the graph I'm showing here, is that this is actually getting into the brain. So if we are taking ketones orally, this red line here is showing the concentration of ketone in brain tissue over an 80-minute period. So this has the potential to be increasing ketones in the blood and in the brain. And in a very preliminary trial that I ran during my postdoc at UBC Okanagan, we ran a trial looking at older or adults with obesity, and we found that drinking ketones 3 times per day increased peripheral vascular function and reduced their fasting glucose. It increased their resting cerebral blood flow, and it improved cognitive performance. And what this graph is showing is that people who tended to have greater increases in their brain blood flow also improved in their cognitive abilities. So this is all early evidence. These supplements have been out only for a couple of years, but taken together, it looks like this could be a complementary therapy for enhancing that maybe energy deficit in the brain, supporting cognition, and maybe improving brain blood flow. So what we're going to do now is show you some of the work that we are now advancing in this field, and hopefully can chat with people in this group about being partners for our eventual research. So I'll pass it over to Geoff.
Thanks, Jeremy. Yeah, so to set the stage for some longer term intervention studies using these ketone supplements, we first want to see the acute effects of providing a ketone drink to people with subjective cognitive decline. So we're currently recruiting and conducting this study at St. Joseph's Hospital, and our main outcomes are total cerebral blood flow and connectivity within the brain. And so we'll be recruiting people between the ages of 55 and 70 who are subjectively reporting issues with their memory. There'll be 3 visits total in the study of 1 to 2 hours each. We'll have a screening and familiarization visit, and then 2 visits where they'll undergo 30-minute MRI scans after taking either a ketone drink or a placebo match control. So if you or anybody you know is interested, you have my email here, and we'll hopefully send out some similar information with this as a follow-up, so you don't need to write things down too quickly. So that's a currently ongoing study. We're also going to be recruiting in the near future for the study run by a graduate student, Claudia Young, and she'll be testing similar effects of these ketone drinks, but specifically in postmenopausal women. And this study will take place completely on McMaster campus instead of at St. Joseph's Hospital. All right, so I'll just wrap up here with a few take-home messages, and then we can get to some questions. So to summarize everything we've gone through today, cerebral blood flow and cerebral metabolism decline with normal aging. These declines, as well as other cardiovascular risk factors, can contribute to dementia decades even before clinical symptoms present. Exercise has a profound capacity to protect and potentially improve cerebral blood flow, the growth of new brain tissue, improvements in cognitive function, as well as mental health. And like we mentioned at the end there, there's also alternatives or adjuncts to exercise, such as exogenous ketone supplements, that seem to be a promising new tool to support all of those mechanisms of cerebral blood flow, metabolism, and cognition. So hopefully that's a good summary of what we went through today, and we'll be happy to answer as many questions as people have for today.
Great. Thanks, Jeremy and Geoff. Fascinating. And I know we in the geriatric clinic will see individuals who have both subjective and MCI decline. And I have to say, I've always strongly advocate, but I think that for exercise, but your latest study that you show really kind of gives very specifics around walking, resistance, and the aerobic. Really essential because it helps so many of the comorbid diseases that many of these individuals have. The ketones is certainly fascinating, with society's fascination with fasting and the ketotic diet. Does that all play a role? Because people certainly say subjectively their brains feel brighter when they're in the ketotic diet. Is this the same process?
I would say the novelty of these supplements is that you don't need to restrict your diet. So folks probably feel this benefit because of they're eating more healthy whole foods. They're probably restricting some of the processed foods, and just in general, their calorie intake is probably a bit lower. A lot of the benefits we do see with, I don't want to say fad diets, but new diets, is caloric restriction. That's kind of the basis. The neat thing about ketones is that the actual molecules of beta hydroxybutyrate or acetoacetate are signaling molecules. So they have ability to modify genetic upregulation and also to signal different receptors throughout the body. I mean, there are evolutionary backup when we don't have food, and they do stimulate these resistance and resilience pathways that are important for stress adaptation during periods of starvation. So I guess long way around saying these are a tool to influence our physiology through the molecule itself without imposing very strict diets on folks. But I do imagine the diets make people feel better for a number of reasons.
Now we have a question here from Dr. George Ioannidis, a former graduate from your program. He asks, do complicated movements, i.e. resistance training or dance, have a greater impact on cognition, blood flow versus simple walking?
Sure. So I can handle the cognition component. What people are finding is that these more complicated activities probably have a better impact on the brain. There's a real push now for combining exercise with cognitive training because you are using these complementary pathways for which the brain really evolved, right? Doing complicated movement in a dynamic environment. I think dance is the best surrogate for what we might see as being that music, rhythm, social component with a complicated movement. I think the challenge with the research side of things is a lot of these studies are controlled environments, controlled dose of exercise, but people are really pushing towards that dynamic and more involved exercise approach. And maybe Geoff, you can speak to the brain blood flow side of things.
Yeah, I mean, those kind of dual task activities can certainly increase blood flow to the brain to a greater extent during those activities. So I think, yeah, from a vascular perspective, it could be helpful, but I'm not aware of any, direct evidence on the cognitive, if there's any superior nature to that from a cognitive perspective. But I think, yeah, there is a physiological basis to think that there's benefits to combining exercise and some kind of complex task for sure.
Yeah, well, there's that notion that neurons that fire together wire together. And there's some early meta-analyses showing that doing combined interventions, whether at the same time or sequential, have better effects than just physical activity alone. So there's probably some merit to the more complicated activities.
So thank you very much. We're now at 1 o'clock. That was a whirlwind, but really great, important messages here, great opportunities for participants to do research. It was a great kickoff to this new style of rounds, integrating research into practice. So thanks again, and we look forward to next month's rounds. So stay tuned. Take care, everybody. Have a great day.